Hi there, everyone who's just been pulled in from the waiting room. We're going to start in about 30 seconds or so. As people who've done a big Zoom event will know, it often takes a few seconds to get everyone through. So I'm just going to wait 30 seconds and make sure that we get as many of you in as possible before we get going. For those who are just joining us, I'm just going to do a tiny few little bits of housekeeping before we get going. So the first thing to note is that if you'd benefit from having captions on for this event, we've enabled the live transcript, which you can access in the Zoom bar, which should be at the bottom of your screens. So you just click on closed captions and it should enable you to see that if that would be useful. Second thing is, please do, if you have any questions, put them in the Q&A function, not in the chat function. I'm really keen to draw on as many of your questions as possible, but I won't look at them if they're in the chat. So do put them in Q&A. And also, it's worth noting here, please make sure those questions are short and that they're on topic, because if you put in a huge paragraph of text, it's unlikely that I'm going to be able to read it whilst also chairing. Final thing is, if you are on Twitter, that you can join us in kind of live tweeting this event. If you want to share your thoughts on Twitter, please use the hashtag #ReformMentalHealth. Fantastic. I think we've now got a good set of people through, so we might kick off. So as everyone will be more than aware, the pandemic has taken a really significant toll on our mental health. So those already living with mental illness have seen their conditions exacerbated and often found accessing support much more difficult. Others have seen symptoms of mental ill health develop for the first time. And there are particularly pressing concerns over the impact that the last 2 years have had on the mental health of children and young people, with the latest data suggesting that as many as 1 in 6 children have a probable mental health disorder. But despite the huge challenges that exist in the mental health space, we shouldn't lose sight of the progress that's been made in recent years. The announcement of £2.3 billion of extra investment in mental health services, the publication of the cross-government suicide prevention plan, the government's commitment to reforming the Mental Health Act, and the recent launch of the Every Mind Matters campaign all stand out as real achievements in this area. But perhaps most importantly, we've seen a huge shift in public attitudes to mental illness and a recognition that addressing mental ill health will require a concerted effort across government and across society. And that brings with it huge opportunities to rethink our approach to mental health after the pandemic. And with us today to discuss that really important theme and the opportunities and also the clear challenges that exist in mental health, we have a fantastic panel of speakers. So firstly, we're joined by Gillian Keegan MP. Jillian is the Member of Parliament for Chichester, and she's been in that position since 2017. And last September, she was appointed the Minister for Care and Mental Health in the Department for Health and Social Care. She was previously the Minister for Apprenticeships and Skills at the Department for Education. Secondly, we're joined by Rob Webster. Rob is the Chief Executive of the West Yorkshire Health and Care Partnerships, one of the biggest integrated care systems in the country. And he was previously Chief Executive of South West Yorkshire Partnership Foundation Trust, a specialist trust delivering mental health, community and learning disability services. And before that, he was Chief Executive of the NHS Confederation. Finally, we have Paul Farmer with us. Paul has been the CEO of Mind since 2006, and he also chairs the NHS England Oversight and Advisory Group, which oversees the current mental health long-term plan. In 2017, he co-authored Thriving at Work, an independent review for the government on how to transform mental health in workplaces. Without further ado, because I'm sure none of you have come here to hear me speak, I'd like to ask the Minister to give her opening remarks.
Well, thank you very much, Sebastian. And I'd like to start by thanking Reform for organising this event and for giving me the opportunity as well to speak at the event today alongside Rob and Paul. And I'm delighted to take part. It is an important discussion about mental health, and it is important timing in terms of after the pandemic. And hopefully we are coming to that point now where we can say words like that, where it looks like we may be getting to the stage where we can cautiously but perhaps optimistically learn how to live with COVID. I'm sure we will all agree that the past 2 years have been tough, extremely tough. The public has shown great resilience during the challenging times, but we do know that the pandemic has had and will continue to have an impact on mental health, on well-being of many people. It's added a lot of stress, it's added a lot of uncertainty to people's lives. And around 1 in 5 adults have experienced some form of depression in the first 3 months of last year, which is more than double the figure before the pandemic began. And we also know that there's been a significant increase in the number of children and young people needing support with their mental health. Data shows now that 1 in 9 children had a probable mental health disorder in 2020. 17 compared with approximately 1 in 6, as you said, Sebastian, in 2020. That's quite a jump in a very short period of time. And there's clearly been unprecedented demand on mental health services. And I know that they're doing their utmost to make sure that these services are there for everyone who needs them during the pandemic, for patients and also for our NHS colleagues too. Let's not forget, are absolutely exhausted, having been on the front line all the way through this pandemic, and it's now, they're entering into their 3rd year of that. Talking therapies have remained open throughout the pandemic, offering digital and remote access, and we've made some real progress actually in those kind of services. This was necessary, but it also worked very well for many. However, we do recognise there was some for whom that is just not an option. So throughout the pandemic, NHS England has continued to emphasise the importance of maintaining face-to-face support for people as well. And as we move forward, they'll continue to work with local systems to encourage recovery of the face-to-face offer, especially where that's in line with patient choice and preference. For those with severe needs or in crisis, all NHS mental health providers have established a 24/7 all-age urgent mental health helplines, which have answered around 3 million calls during the pandemic. And this is an amazing achievement of something that was established very quickly and has managed to reach that many people. In response to the current Omicron surge of the pandemic, the NHS has asked local health systems to ensure that access to the community-based mental health services are retained, and to make every contact count to ensure that those at risk of escalating mental health can access treatment and care and avoid escalation to crisis point, which face-to-face care needs to be retained as far as possible to try and make those timely judgments. We know that over 1 million patients have accessed NHS talking and psychological therapies in 2020 and 2021 as well. And we obviously would thank everybody who's been involved in delivering that service. NHS mental health services are looking after more children and young people than ever before, with over 420,000 young people treated in 2020 and 2021. And that's almost 100,000 more than 3 years ago. But as we know, demand is significantly outpacing even the demand, even the supply that we have managed and the capacity that we've managed to grow. As a government, we remain committed to our ambitions in the NHS long-term plan to expand and transform mental health services in England, and to invest in an additional £2.3 billion a year by 2023-24. And this will enable an extra 2 million people in England, you'll have heard us say before, to access that vital NHS mental health support. And we're also committed to achieving parity between mental health and physical health, and to reducing mental health disparities. We're making good progress on this, with investment in NHS mental health services continuing to increase every year from about 11 billion, which it was in 2015-2016, to 14.3 billion today. And it will continue to go up, as I say, by an extra 2.3 billion by 2023-24. We will ensure that clinical commissioning groups and integrated care boards, once they're operational, will continue to increase the spending on mental health in their area, at least in line with the growth in their overall funding allocations to meet the mental health investment standard. And I would also like to highlight the Help Us to Help You campaign, which it's launched this week, backed by some of the UK's biggest music artists, to get people talking about mental health and emphasise that the NHS is still there for people who need support. This continues to be vital as we emerge from the pandemic with a backlog of treatment, and people need to know that that support is there for them. To address the backlog as we emerge from the pandemic, we've published our mental health recovery action plan, backed by an additional £500 million to ensure that we have the right support in place. And I know we have said these figures before, but this money is still being worked through the system, so it will still make a massive difference as well. The plan aims to respond to the impact of the pandemic on mental health of the public, specifically targeting those groups that have been most affected. And this additional investment is helping to address waiting times for mental health services, which we know are too long, give more people the mental health support that they need, and invest in the NHS workforce. The recovery plan goes wider than the NHS. It also includes a £15 million prevention and early intervention package, which will help to invest in activity to promote positive mental health in the most deprived local authority areas in England, which is also key to our levelling up agenda as well. And this kind of approach is useful. It will help people to it will get to enable us to reach people before they get to the point of needing specialist services. And I think we all agree, everyone on this panel will agree, that the more we can do early on, the more we can do to prevent things escalating, the better. And of course, making sure those services are there in a timely way. With regard to the NHS mental health workforce, the people who are going to provide support, specifically, we've seen a 17.6% increase in the last 5 years, and children and young people's mental health workforce has grown by around 40% since 2018. But we know that even further growth is needed, and we remain fully committed to attracting, training and retaining the workforce of the future. And to support this ambition, we're providing £111 million from the Recovery Action Plan, and that investment will support the training and education of new people to join the NHS mental health workforce. Building on the Recovery Action Plan and on the excellent cross-government work done by the Ministerial Task and Finish Group, I'm pleased to say that the government has announced plans to launch a public discussion paper later this year to inform the development of a new longer-term mental health strategy. And in my first few weeks as Minister for Mental Health, I had the pleasure of visiting the Young Persons Advisory Service in my home city of Liverpool. I actually tagged it onto a trip for my parents, the first time I'd seen them in a long time. It was a very productive weekend, but I learned firsthand more about the fantastic work that they're doing to provide health and emotional wellbeing services for Liverpool's children, young people and families. And I saw how working together, multidiscipline, cross a number of different services, they were coming together to really target a person's needs. And true integration and collaboration, when that takes place, it transforms the outcomes. And of course, with the discussion that we've got on integrating more across our health services, we want to see much more integration and much more focus on person-led prevention. So our plan for the new strategy will set us up for a wide-ranging and ambitious conversation about the potential solutions to improve mental health and well-being, both within and beyond government and the NHS, including all of us. Mental health is everybody's business. We want to challenge businesses, we want to challenge charities, local authorities, and all other sectors to bring commitments to the table as part of the conversation of what we will all do to be there to support mental well-being and help people to recover their mental health. We're expecting to publish the discussion paper in the spring, and I would encourage you all to get involved and help us to shape our approach. We want to do this with you so that together we can ensure that this new plan sets out the actions needed to get everybody to enable them to lead healthier and ultimately happier lives. And thank you very much.
Fantastic. Thank you so much to the Minister for those that really kind of sweeping set of opening remarks. And I'm sure there's a lot to dig into there, particularly about cross-government work in the mental health space. And that's something that I think we're really all keen to reflect on today. But I will pass over to Rob to give his opening remarks now before we get into the into the questions.
Thanks, Sebastian, and thanks, Minister, for providing some a framing for the conversation. So hello, everybody. My name's Rob. I lead the West Yorkshire Health and Care Partnership, and I'm sitting in a trust that provides mental health services today. I think it's probably worth starting by saying that we went into the pandemic in a position where investment was required and recovery was needed. And the Minister's highlighted some of the things that we were focusing on at that time. So routinely having people travelling around the country, whether children or adults, to access a mental health bed is suboptimal. Being in a position where if you're a man with a serious mental illness in West Yorkshire, you die 19 years sooner than somebody who doesn't. These things need addressing, and the investments that are being made by the government through the Mental Health Investment Standard and the mental health reforms that are being put in place are very welcome in starting to address those issues. As we get into the pandemic, though, I think one of the things that it's worth reminding ourselves is that it's kind of 4 impacts of coronavirus on the system. The first is that you have to treat people with COVID and make sure that as few of them are impacted and die as possible. The second is that people who don't have COVID may have had their treatment delayed and we need to catch up. The third is that people with long-term conditions may not have had the support that they needed, and therefore their condition may have exacerbated, and they'll need some extra support. And the fourth is that the mental health impacts of the pandemic are on a slower burn, but a longer burn. So this question of mental health post-pandemic, we have to recognise that some of the impacts of the pandemic, as the Minister outlined, will be bigger and longer than some of the impacts that might be apparent from people with COVID, for example, or delays in COVID treatments. And it's important that we recognise that, because the amount of time it's going to take for us to get to a place where we're, celebrating everything to do with mental health may take a little longer. But during the pandemic, what we've seen is mental health services continue. We've seen services like iAppGo digital. We've seen the recovery rates for those digital services be, over 50%, which is the national standard. So they've been as effective for that cohort of people. And we've seen our staff work incredibly well in communities and in the inpatient settings. As a system, as an integrated care partnership and now an integrated care board, we've been doing this work for 5.5 years and already have our mental health providers working in a mental health collaborative. We already have mental health providers working alongside physical health providers and others in places to join up services around the needs of people. And that's really important, because when we get into the post-pandemic period, what I would really like all of us to understand is that modern health and care services look after the mental, physical and social needs of people. And what we continuously are dealing with, I think, in our acute hospitals, in our general practices, in social care, are people with mental, physical and social needs that need to be seen together. So this idea of seeing the whole person and meeting their needs is felt in integrated care. It's felt in community mental health team transformation, how that's linking into primary care networks, how we start to see social prescribing link workers as helping to keep people well because they've got meaningful occupation, they're not lonely, they've got work to do and so on. So I think we've seen the strength of having those whole person approaches play out in West Yorkshire during the pandemic. We've focused on tackling loneliness through good neighbours. We've focused on our recovery colleges providing interventions for people. We've focused on people who are shielding, getting the right kind of support. We've given our staff support for their mental health and well-being in their daily work, so that people who face more deaths than ever in their career have had access to counselling and support and supervision. But we've also made that available for people who just found it tough during the last couple of years, and everyone's put a real shift in. So I think as we come out of the pandemic and look into the future, I think that we've got to welcome the commitments made by the Minister to ongoing investment in mental health services. We should also recognise that the staffing issues are real and that they're disproportionately distributed, just as health inequalities are across the country. So I think a report by the Royal College of Psychiatrists found that half of the number of psychiatrists in the north and the south, for example. We know that we face 10% vacancies in our registered mental health nursing cohorts. We have to think about different models of care and support. But true parity will be about seeing the mental, physical and social needs of people, backing that through integrated care and making sure that the investment follows. There's a huge amount I could talk about all the successful things that we've been doing and all the things that we plan to do. But I know that we really need to get into the conversation, so I'll stop there.
Thank you so much, Rob, for that. And yeah, hopefully we will get into all of that stuff imminently. Final opening remarks, I'll hand over to Paul.
Thanks very much. Really good to have a chance to speak today. I think I don't want to repeat all the content that you've already heard from Gillian and Rob, but I think it's worth gathering around two areas. The first area is around this growing consensus about the impact of the pandemic. We cannot, I think we, first of all, we are not yet seeing the full extent of this, but barely a day goes by now without a report really condensing and solidifying what we've now been hearing for pretty much the best part of 2 years. So these are, first of all, that actually a lot of people have had to face their mental health over the last 2 years in a way that they've never had to do before. And for some people, that's been a really good thing. because we've begun to understand what it means to look after our mental health. But for many, many people, it's been incredibly challenging and very difficult. The closer you get to COVID, the harder it's been. If you're a frontline NHS staff member, if today's report from the CQC about social care, people in social care settings, and indeed people who work in social care settings, if your family has been affected by COVID because you've lost a loved one, or indeed your community has been affected by COVID because you've lost many members of your community, thinking particularly of Black and Asian communities where the impact has been disproportionately significant. If you're a young person, and if maybe you just haven't, and if you've, perhaps most importantly of all, if you've already had a previous mental health problem, your mental health has got worse. So almost, I think what we're going to see over the next couple of months is just a further confirmation of these kind of key facts. And today, the UCL COVID-19 study reiterating that again and reminding us that this is not a problem of what we went through in 2020, or indeed what we went through in 2021, but actually what a lot of people are going through right now. And the impact and the cumulative impact of that is only going to be really only starting to be seen. So, you know, there is no vaccine for our mental health, sadly. There's no quick fix. There is the need, as both Gillian and Rob have said, for a sustained and long-term view. The second area where we need to kind of coalesce and focus is where do we go from here? Rob's absolutely rightly said that before COVID, what we were doing essentially was a very slow, painful rebuilding process to try to catch up on the great degree of inequality that existed for the mental health system compared to the rest of the NHS. That long-term plan commitment is hugely important, and it's a commitment that needs to be sustained and indeed built on if we're going to be able to get to the place we want to get to. But I think we also now realise that we can't just go on as we've gone previously. We do need to think differently, and we've got to move away from what is essentially a lottery when it comes to our understanding and education around mental health. If we were in a big room now, as I hope we will be in the future, I would probably ask people to raise their hands if they had any kind of mental health education when they were at school. And the chances are that maybe you did and maybe you didn't, but it was a complete lottery. I'd probably ask you to raise your hands if you've had any kind of mental health education in your workplaces. Similarly, some of you will have done, some of you won't have done. And equally, if you're living in a particular community, whether you've had conversations about your mental health or your neighbour's mental health, probably the same response. So that's not really the way to go about it from now on. I think we've learned that if we don't place a protective prevention approach across mental health services, our mental health services will continue to struggle to be able to meet the demand. 1.6 million people currently waiting for mental health treatment. We know that at the moment, mental health services are currently running at 95% occupancy. And sadly, we're seeing an increase in the use of out-of-area placements, despite a couple of years ago getting to the point where we thought we were about to eliminate them. So what does this programme need? It's really good now that the starting gun is being fired on the new cross-governmental strategy. It's a welcome initiative, and it's exactly what I think is needed. So 6 very quick key points on this. First of all, we've got to start by tackling the inequalities in the system. We need to tackle the structural racism, the systemic failure to reduce some of those health disparities that we've seen for such a long time in particular communities, and we need to work alongside communities to come up with different and fresh solutions. And Rob's work in West Yorkshire is really showing the way on this in terms of the community engagement. Secondly, this focus on a more consistent experience in schools and workplaces and communities when it comes to prevention messages. We just can't really have this lottery anymore. Thirdly, dedicated focus on young people's mental health. This, as you've heard from the Minister, the 1 in 9 to 1 in 6 prevalence is a really scary fact. It's scary for society because of the long-term impact this is going to have on our society as a whole. but it's particularly scary for those young people who are experiencing a mental health problem, and of course their families, who are going to struggle to get the help and support they need, despite the additional investment that is in place. So solutions like hubs for young people in communities, voluntary sector involvement in digital services, many others need to be embedded in this programme. Fourthly, a kind of approach to the sustained long-term commitment of building the NHS's capability in terms of the mental health response. The additional 500 million has made a really big difference this year, but that money runs out at the end of this year. I hope that if there is any underspend, it can be carried over, because the 31st of March will definitely not mark the end of the mental health challenge in the system. And the additional money from the long-term plan is hugely important, but we need to build on that further to respond to that additional need that's been created. And that means, in addition to that, the chance for people to get the right quality, the right care in the right place at the right time. And then finally, it's important that alongside this is the commitment to introduce the Mental Health Act into a new mental health bill into Parliament. And I know it's really good to hear that commitment from the Minister. Very much hope that that can be introduced as soon as possible, because alongside the investment is the right legal framework to make sure that people who experience mental health problems really are treated as equal citizens in our society. I'll stop there, Sebastian. Very happy to open up to questions.
Fantastic. Thank you so much for that, Paul. And yeah, I'm really keen to get everyone as involved in this discussion as possible. So please do put your questions in the chat. I'll try to integrate some of the questions that I had in with some of the questions that are already coming in from the audience. And I can see there's already a few so far. One question that I was going to ask to the Minister specifically was about parity of esteem. It's kind of been the language that's governed a lot of this debate and discussion, I suppose, for the last decade or so, and perhaps even longer than that. But I wanted to ask the Minister firstly in general about kind of what we can do in terms of policy to really kind of put the rocket boosters behind that agenda of parity of esteem. And then secondly, in relation to the kind of COVID recovery, and we've got a question about this in the chat, how we can make sure that mental health investment is seen as just as important as physical health investment as we recover from the pandemic.
I'm after you, yeah. I guess, you know, there's very much an appetite to invest in mental health, and there's very much an appetite to invest in prevention of mental health. But there's also, you know, a need to make sure that we build the workforce with us, and that we also need to build the facilities. There's also capital investments. There's all kinds of investments that are planned. But the parity of esteem is effective. I mean, obviously, it is actually enshrined, I think, in the 2012 Care Act. So you can read the words there and then see if you can understand what that means. But to me, what that means is making sure that we keep up with the investment, in line with the investment in our other health services. And I personally think that the prevention and the working together is actually the answer to most things in our most of the challenges in our health service, even with social care, which is the other part of my brief. All of them really come together when you work much more collaboratively, and the integration work, therefore, I think is really, really important. The overlap between physical and mental health is also quite large. And I was in a facility, I think it was a mind group actually, not long ago, and I was asking somebody why they were there, and it was somebody that was waiting for a knee replacement, and she'd been waiting for a knee replacement for a long time, obviously because they're the kind of things that have you know, not I've had to give in some ways as the health services had to obviously respond to the pandemic. And she brought home to me, she said, the way I deal with my mental health and mental well-being, it requires me to be active and moving around. And the fact that I can't is actually making my mental health is actually, so that's why she was there, because she could feel her mental health getting worse and worse, actually as a result of her physical health, that she couldn't use what she would usually use to manage her mental well-being. That there must be many people in that situation with chronic pain. I've got a German debate next week on chronic skin conditions and the link to mental health. So there's, you know, the reality is that it's the person who has both physical and mental health needs, and some of them will be more physical at some times, and some of them will be more mental at others, and that will change at different phases of our life. So it really is the integration of those services, as well as the investment, because I think investment is important to be able to get people, to encourage people to really work together. But those coming at the same time, I think, is really exciting. I am personally extremely, you know, I get this completely. I'm very committed to it, and I think it's, when we look at our mental health strategy, we're going to see all of the areas that if we don't look after our mental health and we don't invest in our mental health and well-being, the massive impact that has on many other services as well across our society. It has many impacts. So I think everybody really understands that. There's one thing, I've got a division bell going, so I apologise for that, and I've got to go off and vote. But there's something, Paul, I want to leave you with, which was my insight of yesterday. And I know that there's the campaign, you know, for the hubs, and actually one of the first places I went to was one of these hubs. But somebody said to me, and I think this is really insightful, if you look at all of the youth services for mental health support, particularly those like crisis services and tech services, etc., basically the peak time when people reach out and need support is 11 p.m. to 1 a.m. So whatever service we have, if it's a hub or whatever, it needs to be open then. So that is the challenge, that and that's not what I've seen so far. So that's the challenge, and I thought that makes perfect sense. And actually, you don't want people possibly, I don't know where they'll go, but you want, you know, you want to have the right support, and we need to make sure that support is there when it's timely and needed. But then obviously the other specialist services are there as required. Yeah, so we need to keep going till we make sure we've got the right answer, and we need to obviously involve young people as well in that.
Fantastic. I can see that Rob has his hand up on that question as well, so I'll bring him in.
I'm going to leave you for a second, go and vote and do my constitutional. I shall come back.
Fantastic, thank you.
As the Minister's leaving, hopefully she can hear that we've got a night owl service for children and young people and their parents between 8 p.m. and 8 a.m. every day, 7 days a week, for that very reason. I was just going to talk about parity of esteem. I think one of the things which is really welcome is, you know, there's that saying, isn't there? Don't tell me what your strategy is, show me where you're spending your money and I'll tell you what your strategy is. And the fact that there's money going into mental health and real investment is part of the strategy. But I think it's the move to parity of esteem is so much more than that. So I think it's financial, it's operational, as described by the Minister. You know, you need to think about how service joined up. If you're going for your MSK session, and what's happening is you're getting physio, but the physio is taking time, and the way you've managed your mental health problem is by going running. You're gonna have a mental health program, so you need to be able to connect that MSK into the community mental health team through the, you know, straight away. So these sorts of things need to be operationally delivered. But there's a massive cultural problem here that we need to address. You know, if I walked out of Fieldhead Hospital where I am today and you know, got run over on the roundabout, an ambulance would be there within 8 minutes and we'd take me to Pinderfield. If I started behaving strangely, shouting at the traffic, the police would come and get me. So we've got this kind of cultural thing going on here, which is sometimes then seen also in the seriousness within which we deal with the pressures in mental health services. So last winter we had to transfer patients in ICU in physical health beds across the country. And I think there was a cabinet meeting about that. We do this every day in mental health services, and we've come to sort of feel that it's all right, and it shouldn't be.
Fantastic, and thank you so much for that comment, Rob. And I wonder if I could just not pushback, but ask a follow-up question about the role of integration here and integrated care systems in this regard. I think there's kind of obviously quite a lot of excitement about what integration can mean for kind of cross public sector work in this area. A lot of the focus is rightly on kind of the interaction, as the Minister identified, between health and social care, but all those other things about policing, the role of other statutory services, and what integration can do, maybe to challenge some of those stigmas and cultural attitudes, but also to join up service provision in such a way that people's kind of whole mental health support needs are recognised rather than just those that apply to the health specific context.
Yeah, sure. I mean, integrated care is not a form. You know, it's about services, joining, you know, seeing ourselves as a guest in people's lives, recognising we're not the only ones, and joining up services around their needs. And in the mental health space, there's well-founded and long-standing relationships between the police and mental health services through the compact and other things which have really paid dividends over recent years. There's long-standing relationships with the ambulance service, with, you know, having mental health nurses in the call centres and so on. And increasingly what we're seeing is a recognition that we need to work together in ways which are going to improve the mental well-being of children. So if somebody asked in the Q&A, have we got good experience working with children? Well, if I look at Wakefield, which is one of our places in West Yorkshire, 3 years ago the service was rated inadequate for children, and through working with the acute hospitals, the mental health provider, the council staff and everything else, and providing really strong leadership into that, we've looked at how do you provide services for children from in care settings, in schools, which recognise that their well-being is one thing, their mental health needs are another, but those things are on a spectrum. And how do you join up care to meet their needs so people are getting the right support at the right time all of the time? And how have we challenged ourselves in the way we've delivered that using Young Lives Wakefield, a third sector organisation, to make sure the children are in the room while we're having that chat. And what that did quite quickly was, firstly, by having the children in the room, makes people behave. So there's less of the it's your fault council, it's your fault schools, it's your fault NHS. And it also gets you onto the agenda that they want. So increasing things like Couth, which is an online mental health support tool, increasing the wellbeing offer in schools, having a clear interface between the wellbeing offer in schools and CAMS, changing the way that CAMS assessments, ADHD, ASD assessments all work so that people get seen by the right person quickly and involving families, has meant that, you know, last week mental health services in Wakefield were rated good with outstanding leadership. Sorry, children's services were rated good with outstanding leadership. Now, that's about ICSs, that's integrated care, that's what these structures are designed to do. So what I would want to see is more of that experience as we go into the integration agenda.
Fantastic. I'll bring Paul in. One of the things that has come up in the Q&A already, and that we really wanted to reflect on in this discussion, is about inequality, both in terms of outcomes in this space, but also in terms of access and care quality, really. It's really striking still that Black British adults, the group that are most likely to suffer from mental ill health, but often the least likely group to access treatment. And I was wondering if Paul could reflect a little bit on what the next steps need to be in terms of that inequality agenda, both about care quality and treatment outcomes, but also in terms of the kind of wider story about interactions with the system for groups that might not be engaged with it in the first place. Yeah,
I just want to make one very quick comment on the previous conversation, if I may, which is around the idea, this idea that parity of esteem is a way of thinking. And I think sometimes we get a bit hung up on the idea that it has to be, you know, it has to be spelt out. I mean, it does have to be spelt out when it comes to the money, which is why Lord Stephen's amendment in the House of Lords is really important to enshrine the ongoing additional investment in the new health and social care bill. But it's also about a way of thinking. So if we take the current backlog of in the acute system, you know, very long backlog, yeah, if we could ask everybody who's in that backlog what support they need to support their mental health before they have their operation, the chances are that their recovery will actually be a lot better. But we don't yet sort of hardwire that into those conversations sufficiently. And equally on social prescribing, you know, we know that physical activity, access to physical activity, reduces symptoms of depression by 30%, but it's really difficult to get access to physical activity on a social prescription. So there's more that we can do in that area, and a lot more that we've learned from our work in Wales with an active monitoring model, which has been freely available to people during the pandemic and has meant that it's seen a significant reduction in symptoms. So it means that we're doing work that is upstream, and you don't then need an 11 p.m. crisis service because you've actually done the early intervention in the first place. You've asked a really important question about inequalities. I think we have failed, particularly Black communities, for far too long. And I'm using, when I say we here, I mean the NHS, I mean mental health charities, I mean the whole system has failed people for far too long. And the consequences are that whenever you do look at the indicators, they haven't shifted. Black people are far more likely to be sectioned under the Mental Health Act. Rob's point about also more likely to come into mental health system through the criminal justice system, not through a primary care route, for example. And outcomes are also worse as well. So we've tried, there've been various attempts over the years, some initiatives more successful than others, but I think what we've now realized is we now need to start with some much more fundamental conversations with communities. And here, the leadership of people like Jackie Dyer and in the delivering mental health equalities work is hugely important. Jackie says, we need to go right to the heart of some of these issues. We need to think about some aspects of structural racism. We need to understand what people's experiences are of services. We need to understand how we have the conversation about mental health. And to that extent, I just encourage people to have a look at BIO, which is a fantastic project which we've been involved in with the U Bailey initiative, the first ever Black-led directory of Black-led mental health services available. This is the kind of conversations we need to have. But then we also need to have much better data. I've been really shocked at the lack of good quality data in the system to really lay bare some of the inequalities and also probably the areas where things are going well. Rob's colleague, Fatima in West Yorkshire, who is a fantastic advocate for community engagement, was in my ear reminding me about how important community engagement is. So this is where integrated care has got the opportunity to provide. It's a horrible phrase when people talk about bottom up as opposed to top down, basically talking about asking citizens what they want from their services and doing it that way around rather than assuming that we have to impose them from the top. And that's a small part of what needs to happen if we're going to reduce those inequalities. I guess the other one I'd highlight would be culturally appropriate advocacy services for people.
Fantastic. I can see that we have the minister back. So yeah, very, very impressive multitasking to be voting and appearing at an event at the same time. So we're very impressed. Could I bring Rob in? I can see that Rob has his hand raised on this question about health inequalities.
Sure. I mean, I think fundamentally integrated care systems exist to improve outcomes, and in doing so reduce inequalities, manage unwarranted variations in care, use their money wisely, and get the biggest social and economic impact they can from that investment. And we've got to work in this space. We've got to be in the space where mental illness, mental well-being, and inequality are considered. So just to give you a couple of examples of what we've done, during the pandemic, when the Public Health England report came out saying that people from Black and Asian communities were more impacted by COVID, we did an independent commission with Professor Dame Donna Kinnair. We said, we think we're doing a lot of work here. Is it enough? She said, you're doing good work. It's not enough. And the 4 things that you need to focus on are the way you commission generally, talk to the people and rather than just telling them. Think about the wider determinants. Think about your leadership and how it represents the communities, and think about mental health. And the fact that they picked mental health out was telling, and it was a 2-way thing that came back. And this was from third sector colleagues, communities across West Yorkshire, that there are issues and stigma to do with mental health that you have to be culturally competent to deal with. And we have to have services which reflect that, and we don't. So we started to address that through the work that we do together. So again, just to reinforce Paul's point, this is the job. If you're not doing this, what are you doing?
No, absolutely. And kind of, I suppose, linking in part back to some of those questions about community involvement and particularly about care quality. I did have one more kind of, I suppose, specific health services question that I was going to ask to the Minister, which is there's a kind of lot of interest in the chat about workforce issues, both in terms of sheer workforce numbers, but also those kind of conversations around diversity in the workforce and kind of delivering culturally sensitive and appropriate care. So I was wondering if I could ask the Minister a little bit about what the next steps might be in that area in terms of boosting the workforce and increasing quality as well.
I'm very happy to. Just on the last question, which of course I missed, so the fact that I missed the whole discussion will not stop me from adding my 2 pence worth, but it's something that's another insight, something that's I've learned in the last 3 months of doing this job, which is another inequality that we don't talk nearly enough about, and that is the overlap between those with learning disabilities and mental health, and actually the outcomes from during the pandemic for that group are pretty much the worst for many, and that's something that I think again is something that we really do need to focus on. I know the Mental Health Act will also have some measures in as well. So that's just something I wanted to add to the diversity discussion, because they quite often get forgotten because their voice is not quite as loud, and I like speaking up for the people who have the quietest voices sometimes, because they need the most support often. In terms of growing the mental health workforce, obviously that's critical, and the diversity point is critical as well. Now, from somebody who grew up in Knowsley in a very, very working class area and went to a comprehensive school, this whole question of how you get from those areas into anywhere in life is one that is actually why I'm sat here as a politician, really. It's this levelling up, this opportunity, how you help people who don't get all the advantages in life, and that can be for many different reasons, whether it's the sort of poorer areas of our communities, or black and certain parts of black and minority ethnic communities, not all, because opportunity again is different. Again, that was something that really we're looking at, trying to understand the big differences there as well. But how do you get into the mental health profession? I always challenge this. If you're sat in a not very good school in a part of our country, with not that many people around you who have those kind of jobs, how do you get from that seat in that comprehensive school into the mental health profession? And I think, first of all, there's the awareness, obviously, but it really is about working much more locally with the local systems as well. The last job I had actually in the Department for Education was really looking at tackling this with local areas, and I expect the local partnerships will work with local skills providers, local nursing schools, local, to really try and generate those opportunities. Apprenticeships are a fantastic way, not just because I did one myself, but a lot of people need to work as well. So I think the apprenticeships is a brilliant way of improving diversity, because they also really help to get that sort of wraparound support that people often need when they're entering into the workplace as well. So I know that in fact, I've worked with Donna Canary when she was the RCN head on actually improving the health and social care apprenticeship routes at all levels, up to master's levels, to make sure that they were there as routes, as more people find it easier to access than potentially the traditional routes, as it were. Stepping forward, obviously, sets out our ambition for 21,000 new posts across the mental health system, and that's occupied by 19,000 new staff, and that's what we're working on right now. So that's really clear. And in the mental health implementation plan, it sets out the need for the workforce to grow by over 27,000 by 23-24. And as I said in my speech, there has been an increase. We're making progress. But the diversity question is one that we always need to keep reminding ourselves. And the question we're really trying to answer is how you get from that seat of a noted comprehensive school, or how they get as an adult who's left school without any GCSEs because they didn't get a shot, how they get from there into the profession. I was very struck when I became a board governor on an NHS board in my bid to turn myself from a business person into a politician. I was very struck at the recruitment strategy in 2015-16. It went like this. Advertise and recruit as many as possible nurses, this was, in Spain and Portugal. Once depleted, book tickets to the Philippines, go to the Philippines and start a recruitment campaign there, which, by the way, everybody else was doing in Asia as well. And when I asked to see how many apprenticeships they were offering, 0. Now, I'm delighted that now there's many tens of thousands. So it has changed very quickly. But that was only in 2015, 2016. And I am guaranteeing that in many of these trusts, in many of these places around the country, that most of their recruitment, they'll be looking probably to universities. So if you want to increase diversity, apprenticeships is what I would say, because they're a very good way of improving diversity in workforces. Fantastic.
Thank you for that, Minister. Just one quick thing. It seems like your microphone might be cutting out just a tiny bit, so just making sure that we can hear you properly.
Any of that, because that was like my speech.
No, we did. No, we did. Don't worry. Could I bring? I can see Paul's got his hand raised, so I'll bring him in on this.
Quickly, actually, I think the recruitment of new staff in mental health services has been a real success in the last 5 years, and in extraordinarily difficult circumstances. In fact, if we hadn't had those additional staff members, the consequences to our mental health services would have been, and to people with mental health problems, would have been catastrophic. So, huge credit to folk like Adrian James at the Royal College of Psychiatrists and others for doing that. I think we've got 2 things though that need to be addressed. One is that broader, thinking about the broader workforce and bringing people in to think about a career in mental health, and I think that is eminently sensible and possible, and needs some more cohesion to be able to do that. But secondly, really also making sure that there is a better join up across the health and social care workforce when it comes to supporting and paying people. I think there are a lot of our third sector provider colleagues in local mines and others are seeing real trouble at the moment in terms of recruiting people, and we need to make sure that there is the parity for people who are working in both systems at the moment. And I think particularly actually constructing a really strong pathway for people to think about developing their career in mental health. So, for example, we have many peer support workers now, but at the moment, the job promotion opportunity is to go from being a peer support worker to being a senior peer support worker. Well, perhaps we could open up some of the opportunities to develop careers right the way through the system, which will also increase the diversity of the workforce, in addition to really properly utilising the apprenticeship opportunities that the Minister mentions as well.
Can I just add, the apprenticeship, half the apprentices in this country are older, and in the health service, I met somebody in my local hospital who had been a domiciliary for 16 years, and she ran after me and as the other apprentice and said, "I've just finished my children's paediatric nursing apprenticeship." What you really need to understand is it's opportunity that's passed people by, not their intelligence or their ability. It's opportunity that's passed them by, and that's upon us all to really remember that, because there are so many of those examples, and people need the confidence. If you've never felt good about your interaction with education, you need your confidence being built, and apprenticeships, again, a great way to do that and go up the levels.
That's, I think a great point, and also one that I think we should all reflect on in terms of a lot of this conversation around workforce tends to be about how you get people right at the start of their career in, but these kind of questions about ongoing training and development and continuous professional development for people who work in health service and education, I think is all important. I'll bring Rob in on this one as well.
Yeah, I don't want to repeat what's been said. I think the additional things I would add, fully support the idea of careers in our system and the fact that you can move between care and the NHS, and we've got good examples of that. as integrated care systems become responsible for workforce, which we are, then it's much easier, I think, to start to do things that are going to make a difference. So all around me in West Yorkshire, there are places where people across generations haven't had a job, and there are, you know, organisations in the third sector in the NHS and in care who can't get people. So we're saying, well, how do we close that then? How do we solve both problems? By getting people to recognise that you can. There are over 300 different careers in the NHS. There are lots of different careers in the mental health space. What we need to do is get people to recognise that those careers are for them, and that they'll be supported, and it'll be a good place to work, and people are kind and compassionate at work. So we're doing a lot of work in this space. We've got a virtual careers fair coming up next week for mental health roles and new roles in mental health services. So I think the more that you've got this opportunity in local places to tap into that potential that the Minister talks about, the more that we can see this as a problem and an opportunity, I think more successful we'll be.
Fantastic. And I wish we'd be able to get today to the questions about employment and mental health that I know Paul's done a lot of work on. But for the sake of time, and I know that there's at least 10 questions in the chat about child and adolescent mental health services and the importance of early intervention. So I could ask panelists about their reflections on kind of what needs to happen there. I know we've all talked about the really worrying numbers of young people who are suffering with mental ill health, and maybe particularly wanting to focus on what's happening in schools and what partnership working can look like between schools and the NHS, but also what can happen in terms of early intervention and prevention. Love to hear people's thoughts. Maybe if I could start with the Minister.
Yeah, I mean, obviously this is vital. It's not gone unnoticed by anybody of the pandemic, and actually it's uncertainty. Being in the Department for Education before and then coming here, you know, we thought a lot about this and worked a lot with the Department for Health, because you know, there has been so much uncertainty. People have been in school, out school, exams, not exams, mocks count, this one, that. I mean, so it's like, it's really, really been very distressing. They've missed out on all of the events, pretty much all the things that they look forward to, whether it's their residentials, whether it's their proms, whether it's just seeing their mates and parties, or what. They've missed out on so much stuff. And on top of that, there's also huge problems, I think, with a lot of the materials that they're sharing and having access to on social media, and you know, some of these dreadful sites that
We're just missing your microphone, Minister.
Oh, sorry. Can you hear me now? I don't know what to do because it's my PC.
Yeah, that's okay.
Not a good one. But I was saying, you know, as well as all the uncertainty that young people have had to deal with and missing out on all those things and all that friendship and support and their structure, there's also this other growing and very concerning social media content. A lot of the content that they're looking at, not just you know, stuff that's not good for their mental health in terms of comparing themselves, but actually some really dangerous stuff online around suicide, around self-harming, around eating disorders, etc. So there is a massive need that we have, and it's got a multifaceted approach that we need to have. Obviously, one of the focuses at the moment is building those the schools, the teams in schools, the mental health support teams in schools that are properly trained. It takes about a year to train them, so we're building those and rolling those out. It'll take us about you know, a while, because we've got to train enough of the people up, but I think that's going to be a very important part of it. And obviously at the same time, building up the capacity for eating disorders, for other common mental health, and obviously access to talking therapies as well. But there is a lot. We've obviously got a wellbeing for education recovery program as well, which has been invested in. But it really is about trying to capacity, 345,000 more appointments, and trying to make sure that we can get more at the preventative stage as well through school. Having those conversations. I mean, I was speaking to a group today who operate some of the online and tech services. You know, how we can really use technology to very much access better and provide more preventative support to children and young people is also something we need to be more ambitious on as well. But it's worrying. You know, it's worrying when you look at you know, the sort of things that people are seeing online, and then the impact that's having on certain behaviours. So the online harms bill will also be quite important. We need to be able to take down some of this stuff, because it really is having a very negative effect on lots of young people.
Absolutely. We're almost at time, so I'm going to have to very quickly pass over to both Paul and Rob for kind of 30 seconds of final thoughts.
Well, look, I think this is the one area that really puzzles me, to be honest, Sebastian. I think we've got clear solutions, we've got clear need. I really don't quite understand why we can't put that additional investment in now to support the various layers. CAM services are really struggling because so many people are dropping through into them who could be supported, not just in schools if we accelerated the schools programme, and in communities if we invested in hubs. I don't think it would be very difficult to do. I think the capacity in the workforce is there, in not just in the NHS, but in the voluntary sector and in other places as well, and in schools. And I think this is the one area where you know, that addition, one of many, but particularly where I'm just still really puzzled as to why that additional investment, we haven't run that battle with the Treasury to get that additional investment into mental health for young people. And I do worry about the consequences of this, I'm afraid, I really do.
That's it, yeah.
Correct, we do actually have additional investments in children and young people. It is a part of that investment. So we do have investment.
But not more than was originally planned for the long-term plan, Minister. I'm sorry, that's the case.
You know, again, you've got to train people. There is a pipeline. You've got to build buildings. There is a pipeline. These things have to be done. And you know, and I'm not making excuses there, but I'm saying if you have to implement stuff instead of just lobbying for money, it's a different scenario and it's a different ask. And I'll just be honest like that, because that's what I am.
Fantastic. I mean, I don't want to, yeah, I mean, very important area to focus on, of course. And can I finally bring in Rob for final comments? Thank you.
Yeah, so just on that, I mean, I think we're good at delivering things, aren't we? So if we have a coherent plan, if we have the investment, if we have the staff, we get it done generally. We're just seeing that with the vaccination booster program. What I think we need in this space is when people talk about integrated care, they always think about older people. That's a generalization, but people's general mindset is, oh, they're talking about frail older people now and have to join. This is what integrated care is about. How do we join up services around the needs of children and families so that they can fulfill their potential? That's why one of our 10 big ambitions in West Yorkshire is to ensure that, you know, the impact of poverty and childhood obesity doesn't wreck lives for the future. So I would say just let's make this part of the integrated care agenda. Let's give the minister and the departments involved a delivery vehicle. And if we've got the investment and the money and the coherent policy, we can deliver it.
Fantastic. I think that's a great point to end this discussion on. Thank you everyone so much, and all of our panelists for giving up the time today. I think this is a fantastic discussion. I've seen someone post in the chat about whether this has been recorded. It will be, and you'll be able to follow it up afterwards if you missed anything. But yeah, thanks again to everyone. I'm going to end the Zoom meeting now. It'll be a bit abrupt, but yes, thank you so much, and have a lovely evening.
Thanks, Sebastian. Thanks all.
Thanks, everyone.